Supermind. Present. Bipolar test. The seriousness of bipolar cases is indisputable. In fact, many patients who have symptoms of a manic depression state can be misdiagnosed. Another important fact is that a bipolar test can actually take years before a person is correctly diagnosed. Simply put, this mental illness is very difficult to detect. When a person with manic depression disorder is high or manic, it is not surprising that he won't feel the need for a test. Therefore, only the depressive tendencies are diagnosed most often. The result is an inaccurate diagnosis of the patient, concluding the symptoms as depression only when it is actually a bipolar issue. When a doctor conducts a bipolar test, the patient will be asked with a series of questions, assessments, laboratory exams, and constant observations. These are strategically outlined to determine if you have the disorder and to understand the level of concern. The tests will consist of the following points. Origin in cycles. It is advised that you recall the details as to when your manic depression episode started. The frequency of your bipolar cycle will also be important in diagnosing your problem. This will help your doctor in understanding the level of seriousness of your problem. Your family background and personal history. The bipolar test will also include questions of these types. Bipolar disorder is often caused by your childhood environment and may be attributed to your family relationships. Assessment of your mental health. Depending on the level of concern, it is possible that you will be interviewed separately to determine your emotional quotient, memory and thinking capabilities, and your reasoning skills. Medical history. The doctor may also ask you about drugs that had been prescribed to you in the past years. If necessary, he or she will also ask if you had been taking illegal ones. Drugs are possible causes of bipolar disorder. Lab tests. When necessary, and if you have indicated that you have been taking drugs other than those prescribed, you may be subjected to a laboratory examination. Reference. Especially if the doctor finds that you have a serious bipolar disorder, he or she may inquire about you from your friends and family members. If your doctor asks for names of your friends, give them to him or her. Observation tests. You may have to undergo a series of tests that aim to observe your behavioral patterns and mood swings. Sometimes it is even necessary to consider observing your physique and how you dress. For more about mind and mental health, we hope you to visit http://mentalhealth51.blogspot.com